Congratulations! After 40 long weeks, your infant has finally made his or her debut. So now what?
During your newborn's first week, the desire to eat will reign supreme. Your little one will probably nurse every 2 to 3 hours, although formula-fed babies may last a bit longer between feedings. In fact, infants have what's known as the rooting reflex, which encourages your baby to open up and suck when faced with a breast or bottle. And your baby will be eager to do so, since newborns have highly developed senses of taste, and even at such a young age, can differentiate between sweet and bitter. Although your baby is eating often, your newborn will still lose up to 10% of his weight during this first week, as he sheds the extra water weight he was born with. In addition, your baby digests food quickly, so expect as many as 8 to 12 bowel movements a day and 5 to 6 wet diapers. And when your baby's not busy nursing or pooping, he or she is probably sleeping. Most infants will sleep 14 to 18 hours in a 24-hour time frame, although that's usually broken into several-hour intervals. During your infant's first week, your baby may also look a bit strange to you, and that's okay. After being curled in mom's tummy, most newborns stay scrunched up for a while, with arms and legs that may look bow-legged and bent. You'll also notice that when startled, your baby arches his back and extends his arms and legs, a habit known as the Moro reflex. Because of these natural reactions, your newborn may be most comfortable swaddled snugly in a blanket at first. There are more developments to watch in the coming weeks, so stay tuned.
Your newborn is only 1 week old, but your baby already has certain preferences, the biggest one being looking at you.
Your baby was born nearsighted, and even though eyesight is still fuzzy, he or she can see you in detail when you're 8 to 10 inches away. And studies show that newborns prefer human faces to all other patterns or objects, so give your baby plenty of face time. Help your baby develop those eye muscles by slowly moving your head back and forth or bringing objects close to him, then moving them away again. And at this point, your baby can even recognize your gestures and faces, so play by raising your eyebrows or smiling. Many 1-week-olds will even respond in kind. Don't worry if your little one looks at you with crossed eyes. It's often a part of normal development. Although your baby is busy learning, this second week of life will still center on sleeping and eating. If your infant is indeed eating enough, he'll pass frequent mustard yellow or dark stools and will wet up to about 7 diapers daily. All that eating will also ensure that your baby gets back up to her birth weight, or beyond, this week. And while your newborn sleeps, you'll want to keep your baby on his or her back to help reduce the likelihood of sudden infant death syndrome, or SIDS. When your baby's awake, though, encourage your newborn to spend time on his tummy, which will help him learn to hold his head up. What a week, huh? Stay tuned for all that's to come in your infant's third one.
Have you seen the episode of Sex and the City where Miranda's changing her baby, and his belly button falls off? Well, welcome to week 3.
Of course, in reality, your baby's belly button is firmly attached. But the umbilical cord stump isn't, and it will usually fall off at some point 10 days after your baby is born. Once this happens, you'll be able to see if your baby has an innie or an outie belly button, and you'll also be able to start tub baths. Other than the belly button's debut, your baby's third week will still focus mainly around eating and sleeping. And while your baby is becoming an old pro at both, you'll likely notice an additional skill, and that's crying. Because your baby doesn't have another way to communicate yet, this is how your newborn tells you that he or she is hungry, sleepy, sick, dirty, uncomfortable, or just in need of some cuddling. Most parents learn pretty quickly how to respond to their infant's cries, but sometimes comforting a baby isn't that easy. Up to 25% of newborns will experience colic, which is a fancy word for incessant crying that lasts for up to 3 hours, at least 3 days a week. Because doctors don't know exactly what causes colic, no medical treatments are currently available, but several things have been found to help colicky babies. Babies are comforted by gentle motion of all kinds, so invest in a rocker, baby swing, or simple bouncer. Your baby might also find it soothing to be walked around the house in a front pack or sling. And many parents find that a ride in the car, with its movement, noise, and vibration, is the best remedy for colic, It's important to note that what works for one baby won't necessarily work for another, so experiment and find out. If your infant is otherwise healthy and attended to, colic is generally not a cause for concern and tends to ease by your baby's 3rd month. Whether your baby is colicky or not, make lots of time to snuggle, rock, and caress your infant. Your 3-week-old knows you by now, and there's nothing more comforting to your baby than the sound and feel of you.
You may be wondering if you'll ever sleep again, or if you still own a shirt that's not stained. Luckily, this week brings a reward for your hard work, your baby's first smile.
It's true. By the end of the 1st month, most babies will start to aim smiles directly at you. And at this point in development, your baby may even use those new neck and shoulder muscles to lift his or her head briefly. Encourage your baby to do so by letting your newborn rest on his or her tummy when awake and putting your face in front of her. Or roll a receiving blanket into a log and place it under your baby's chest to help her push up. And when your newborn's not playing with you, your baby will probably be eating voraciously this week. That's normal, since this is one of your baby's first growth spurts, and your newborn may have gained an entire pound by month's end. You may have noticed that even when your baby isn't nursing, your infant is making sucking motions with his mouth. If you try to feed and there's no interest, your baby may just be looking for soothing. Offer a pacifier to help. And don't be surprised if your baby uses her own thumb or fingers to self-soothe. Remember that you should make an appointment for your baby's checkup with your pediatrician by the end of this month. This will allow your doctor to affirm what you already know, that your baby is doing a great job of growing.
Your baby's 3rd month ushers in your newborn's first graduation. Your little one has now made the transition from newborn to bona fide infant.
As your baby enters this stage of growth, your infant's budding personality becomes more apparent, and you'll start to notice silly, serious, finicky, or determined traits emerge. As your baby becomes more self-possessed, you may also notice that your little one is starting to favor you above other people. Your infant will show preference for your company by smiling, laughing, and waving those little arms and legs when you're around. On the flip side, though, your infant may act more wary around strangers or even fuss when new people want to interact with him. When not busy making faces, the baby will continue to eat voraciously and will grow rapidly as a result. The average 3-month-old infant will weigh in at 13 pounds and measure 24 inches, although anything from around 9 to 16 pounds and 15 to 22 inches is normal. Sleeping is still the biggest part of your baby's life. Hopefully, your little one is finally beginning to learn that nighttime is the time to sleep. Some lucky moms even find that their 3-month-olds will sleep for up to 6 hours at a time. Regardless of how much your baby sleeps, when awake, your baby may surprise you this month by rolling over halfway. Your infant is also probably doing baby push-ups or using those arms and shoulders to lift that head high when playing on his front. Encourage these efforts by clapping and telling your baby how proud you are of these new skills. But remember, anything within your baby's reach is fair game. Be sure to watch your little one carefully, however, to make sure that the things being grabbed are infant appropriate.
Your baby is no longer quiet. Who is that chatty little one gurgling away?
Most experts believe that your baby's 4th month brings an understanding of all the basic tools that comprise his or her native language. Your baby will probably start trying to produce these sounds and will progress from vowel-only words like ah to consonant ones like ba. You probably won't hear dada or mama for another month, but that doesn't mean you can't encourage these early attempts. As your baby learns to communicate with these new words, you'll also find your infant laughing more. Tickle this newfound funny bone by playing peekaboo or by laughing back. And as your baby is practicing new words and sounds, your little one is learning physical skills as well. By the end of the 4th month, many infants can grab toys, roll over, and in some cases, stay in a supported, seated position. If you hold your infant in your lap in a standing position, you may even find that your baby pushes down on your legs. Your baby may also discover his or her feet this month, so don't be surprised if you find your little one playing with those appendages. All that playtime can be exhausting, and most 4-month-old babies will sleep through at least part of the night. Your baby will still need naps, but may be content with just 1 or 2 now. Because your infant's tummy has grown, your baby can eat more at each feeding. In fact, many babies at this age only eat 4 or 5 times a day. At 4 months, some parents wonder about supplementing breast or formula feedings with solid foods. But there are many advantages to waiting, including a possible decrease in the development of food allergies. For this reason, it's wise to discuss solid foods with your baby's pediatrician at your next month's appointment.
It's the 5th month, so don't be surprised when your little one starts to recognize his or her own name.
Aside from this newfound name recognition, your baby will learn lots of other things this month, like object permanence. Object permanence means that your baby will start to understand that just because you put the bottle out of sight doesn't mean it no longer exists. Your infant will also begin to identify objects that are only partially visible, such as a favorite toy tucked halfway under the couch. As your baby comes to these startling realizations, playing peekaboo and hide and seek will bring hours of fun. In fact, your little one will like to play pretty much anything with you, as attachment to you and other caregivers grows. On the flip side, this means if he or she hasn't already developed stranger anxiety, it is likely to happen soon. This normal developmental milestone requires patience and understanding on your part, and gentleness on the part of people whom your baby doesn't know. Your baby's senses of sight and sound will rival yours. That means your baby will now be able to hear sounds and connect them to their source, as well as discern very subtle differences in light colors. Meanwhile, your little one may also learn to sit up unassisted. Your baby may even be strong enough to hold his or her own bottle. Just remember not to leave your infant alone with one. You may also decide that your baby is ready for solid foods now, although it's best to make this introduction only with your physician's approval. So, if you haven't already, ask about food introductions when you go in for your baby's 5-month checkup.
Your baby's not crawling or walking. Yet. But your 6-month-old is probably figuring out plenty of ways to get around.
Now that your baby's arm and neck muscles are a bit stronger, he or she may be rolling from back to front, and vice versa, on a regular basis. Many infants even use this skill as a method to move from one place to another. As your infant prepares to crawl, you may find your little one hoisting onto all fours and rocking backward and forward. Your baby will also probably get a kick out of standing and bouncing on your legs as you support her. Another surprising development this month? Your little one's first tooth might appear. While some babies sail through the teething process, many feel discomfort and aren't shy about letting you know. Make teething less painful by giving your little one a teething ring or feeding your baby cold food like applesauce. And if the discomfort persists, speak to your doctor about types of mild anesthetics for your baby's gums. And speaking of food, if you haven't introduced solids yet, you'll probably do so this month. Although 6-month-olds continue to get most nutrients from milk, experiments in food will teach small motor skills and swallowing. This month, your baby also continues experimenting with one-syllable sounds and expressions of delight or disgust. Because your baby won't be able to talk for some time, some people advocate teaching hand signs to your baby. To do so, use a hand signal every time you mention a certain word, such as pointing to your mouth for hungry. Your baby will catch on and may begin to use these signals to tell you what he or she is thinking. Congratulations for making it through these first challenging and rewarding months.
Did you tell your infant not to pull the dog's tail? Then you can bet your baby will try it out now.